Hi, everyone. Welcome to another ALK-tALK. My name is Mark Rosenzweig. I'm from West Bloomfield, Michigan. I was diagnosed with ALK in 2013, just celebrating my 12th anniversary, and I'm in my 13th year. I like saying that. It gives me some street credibility. Um, and I just want to say that there's a closed caption button on the bottom of your toolbar. So if you don't understand how I speak or English, you can go ahead and do that. Closed caption, you can change your settings on your language, which is really cool. And my guest right now is in her third year of third time talking to us, but I'm going to get back to her in a minute. So I want to show you our calendar. So let me share the calendar with you. This is our Healing Arts program calendar. This comes from our ALK-positive.org website. So just jump onto ALK-positive.org, hit the Living with ALK, and then hit the Healing Arts calendar, and you'll see this. The purple button on the bottom will get you right directly to our Healing Arts programs, which is the same channel as the ALK-tALK. So I'm going to stop sharing that button, and I'm going to start up one polling question. And this is a two-part question. So, question is, do you go anywhere for counseling? Yes, no. And then the second, if yes, there's a couple buttons on the bottom there. Do you see a professional therapist? Group counseling? Do you do any ALK positive healing art programs? Do you go to other lung cancer groups, or do you do others? All right, so we have 38% of you do see somebody for counseling, 62% have not. Where do you see them? 83% see professional therapy, 25% have been to our ALK positive programs, which is great. And then we have 17% is other, and 8% lung cancer groups. Stop sharing that. And I'm going to go ahead and pass the microphone over to Summer real quick.
Hi, I'm Summer Farman, ALK positive patient since the summer of 2020, and Mark's sidekick. Thank you all so much for joining us this evening. Dr. Schurgin is one of my favorites. I think you will find some great takeaways from her, and she is so soothing to listen to as well. So we had so much fun in our pre-meeting. But before we get started, let me hand it over to our philanthropy manager, Katie Delaney, with some exciting news.
Hi, everybody. I just wanted to take a quick second out of this call to say a huge congratulations and thank you to everyone who supported our Lung Cancer Awareness Month campaign. Together, we collectively raised over $1.3 million. So we are continuing our efforts, but I just wanted to jump on and say thank you and a huge congratulations. And excited to see what we do to end the year with. So thanks for letting me hop on for just a few moments to say thank you. That's all.
All right, that's awesome. And it's unbelievable what our little group does. And I want to give the backstory of how I met Karen. So back in 2012, I was diagnosed with Hodgkin's lymphoma and stage 3B, went through my chemotherapy, figured it was just a bump along the road, and go on about my life. 8 months later, I was diagnosed with lung cancer. And at that point in time, I went to my local cancer institute and went into a men's group meeting and asked the social worker if I can see her directly. And she gave me Karen's card and said, call up Karen, Dr. Schurgin. So obviously, it's kind of an interesting story, but our parents knew each other. So I didn't really know Karen. So I figured I'm safe. I can go there. So we went there. I think it was in 2014 that we started meeting. And we really have a terrific relationship. And she's given me a lot of wisdom through the years. And I've learned a lot. So, Karen, can you give us a little background of where you are and what do you do, and especially with cancer patients and care partners?
Certainly. I have been a therapist since 1990, so a little while, and I have been working specifically with cancer since about 2006 or 2000, yeah, I think 2006. Um, I have a doctorate from a very small school here in Michigan. And that school said, find your interest and find your own internships. And when I did that, I said, well, one of my curiosities, one of the things that I've just started working in is a little bit of health psychology. And so one of the internships that I chose was at Carmanos. Carmanos Cancer Center is a wonderful facility and it offers a lot of mental health support to the individuals who are being treated for cancer there. So that's how I started. And then as I progressed, I ended up working at a very, very small mental health agency here in the Metro Detroit area and have been here for, I want to say, almost 20 years, 19 years.
And Karen, when I came to the idea of doing a healing arts program, Karen jumped in and actually she was the first professional that helped us set up our art therapy programs. So obviously you were like one of the first
Oh,
ones who jumped into
my
the
my
healing.
side hustle is that I'm a professor at Wayne State University in the art therapy department.
Right.
So I have
So
a little side hustle.
I think we're on our fifth art therapist, which is amazing. So thank you so much.
And
And
we're about to have two new art therapists join us, and one of them is named Summer, and we think that Summer has interest in doing the ALK program. So,
and we really can only handle one summer, but I guess we'll do two. So my question to you, as an art therapist, people have come to me and say, "You can't even draw. Why do you do art therapy?" So why art therapy is so important? Do you think?
art therapy, first of all, what we know about art is that even something so simple as coloring or as um, being a little bit creative with collage materials, a glue stick, which is a fairly large, I'm thinking I have one right here, like a glue stick. This is a pretty big thing to use graphically. You can create imagery that's representational of where you are emotionally, where you are feeling physically. It is a it is a record that you keep. And for some people, artwork creates legacy. And so when we have legacy, especially when we're dealing with health issues, legacy allows people to know how we're feeling, where we've been, and have something tangible that is a memory of us as we leave.
And then if you saw the polling, you saw that 60 some percent of us don't see counseling of any sort. So can you give us some advice of why it's so important in, I mean, you know, the depth of our type of
Well,
cancer that we have.
one of the things that I think is really important, and Mark, you and I have talked about this at length, is that um, our our partners, our loved ones, sometimes it's very, very hard to talk about certain topics with the people that we love. We don't want to talk about our pain. We don't want to talk about our fears. We don't want to talk about death. We want to have a safe place to talk about those things and our worries about those things and processing our way through those things. And sometimes the people who are closest to us are not the people to do that with. And so a professional counselor or an ALK group or the Death Cafe or some of the creative groups, the ALK Arts program, those groups provide a therapist and a place where that content can be discussed safely and with other people who are sharing in those same experiences.
If you do have any questions, put them into the chat box down below. The other thing too is, can you give us an idea of how do we seek out and try to find professional therapists?
Uh, the fastest, easiest way is to first start with your cancer center, the cancer center closest. Most cancer centers do have a social worker on staff, and that social worker can, like Kathleen Hardy did, can refer to a therapist in the community who is comfortable and familiar with usually your type of cancer, and if not your type of cancer, at least is familiar with cancer. The next step that I would pursue is I would probably go to an, a website like Psychology Today. Psychology Today has the ability to sort through therapists who are in your geographic location. They take your health insurance. They are individuals who maybe have specialties listed, and you can look at their specialties and make some decisions about whether or not you feel like it would be a good fit. And then the third possible way that I would seek therapy is to go to a group, like a family service association or Catholic Social Services or Jewish Family Services. Organizations like that often have a large number of therapists on staff. Samaritan Counseling Center, where I am, has 20 to 25 therapists at any given time on staff, several of whom have either worked with ALK or have worked at Carmanos. And so many of our staff is comfortable and familiar with health issues.
So you and I have met for, I think, around 12 years or so, maybe
Has it
10
been that
years,
long?
10, 11, 12. I don't know. It flashes by.
It was just a couple years.
Yeah, it's just last week. But my question to you is, you know, the cancer that most of these people have, I think all of them have on this call. And what do you think is the most difficult thing that you and I have talked about through the years about with this type of cancer?
Well, I always think that fear of dying and what that's going to look like and what that's going to mean is always difficult. This cancer has certainly come a very long way. And Katie, that was one of the reasons why I absolutely wanted you to make that announcement before I even said a word. That that money becomes important for research and for treatment and for all of the things that I think keep people with ALK moving forward in healthy ways. And to me, that is really the most important thing.
So you've seen the
Well,
ups and downs of the roller coaster effect.
Oh, we
You've
have
seen my own personal.
we've absolutely ridden that roller coaster. And the roller coaster ride in my mind is we have to go through scans, and the scans are every how many months? Are they
90 days,
every
3 months, 90
3
days.
months, 90 days. And so the beginning of the roller coaster is I am anxiously anticipating the scan and I don't know what it's going to say. And then I get the scan and then I finally get word that the scan is good or maybe the scan is not good and I have to go for a treatment and I start coasting for the next 90 days on that the scan is good until I have to start worrying about when the scan is going to be again. And then we have to do that same ride over and over and over. And that up and down ride becomes, in some ways, for us, I think it's become a norm. But we've talked about it in terms of anticipating that it's going to provide some level of anxiety and some level of fear and some worry. And we have to start thinking about what things are important and how we want to plan and what things are. I'm thinking about things like we've talked about 5 wishes, and I've always said plan while you're healthy. It's so important to make plans while you're healthy.
Let's talk
Um,
about those plans. What
Yeah,
types
what
of
are the
plans are we
five
talking about?
wishes?
Yeah,
what are the 5 wishes? Mark,
Yeah.
what are the 5 wishes? I don't have my cheat sheet with me.
I'll have to grab mine.
Okay, the five wishes
Now,
speak
now keep
to,
keep keep in mind that these five wishes I've not filled out. And okay, so the
no,
first one
this is
is
something that we've been talking about. We've been talking about the five wishes, I think, for two
I'm a
years.
procrastinator.
And it's, I think as long as we don't get them done, it's going to
Yeah.
be
Well,
fine,
number
right?
one is the person I want to make care decisions for me when I can't. The kind of medical treatment I want to or don't want. How comfortable I want to be. How I want people to treat me. When I want my loved ones to know.
And so
So,
one of the reasons that I keep kind of pushing this, and Summer, I told you, and Dana, I told you, and Mark, you know this. I um I recently lost both of my parents. Both of my parents died within a period of about 2 months. My mom had been ill for a very, very long time. And one of the things that we needed to know as caregivers to her were things so simple as, did she want to listen to music? What kind of music did she want playing in her room? When it became difficult to swallow pills, how was there something special that would make it easier for her? And I always joke that my mom's favorite ice cream was peppermint stick, and my dad was very insistent that it was Moose Tracks, and he brought her Moose Tracks ice cream, and I brought her peppermint stick, and do you know who was correct? Peppermint stick ice cream, and they would bury her medication in the peppermint stick ice cream, making it much easier for her to take in her medication when it was not very easy to swallow and it was not very easy to taste. So things like, what are the things that you want that make you comfortable, that make you happy, that bring you joy? These are things to share and talk about long before anything happens. I had all of this stuff written down, having had these conversations with my mom when she was healthy.
right. So your job was a lot easier. And then, unfortunately, when your father got sick 7 weeks later, then
Oh,
what?
he was sick 2 weeks later, Mark,
Oh, two
and he
weeks.
and he was deceased 7 weeks later. And
Mm.
we had no idea what he wanted. We had no plans in place because he was quite convinced that he was going to live for much, much, many years beyond my mom. And unfortunately, he was he got COVID at my mom's funeral and passed away. And so I was in the hospital with him for 2 weeks after my mom's death, and then every day from there
Right. So
forward
not
until
only
he
are you
passed
coming to us
away.
as a professional, but you come to us as a person who's
As a
lost.
as a so I'm not
Right.
only a professional, but I'm also a caregiver. And I'm
Mm.
also somebody who's gone through the grieving process this past year and understand grief and loss.
So
And
can
I,
you give us some ideas for some care partners or room or patients who have not had these conversations? How easier it is to have them when you're
It's
healthy?
not easy to have these conversations. Let's just start off there. These are not easy conversations.
well, and I
These
just
are,
want to jump in too, that on top of it, these are conversations. Forget if you were just talking to our community, you could say this to a room full of healthy people, right? Like
I
we
do
have,
say this to healthy people, Summer.
right? Because
I
look at
have
your
this
dad,
conversation all the time. This
right?
is a
And I,
conversation that I truly believe is important. From the
yes,
bottom of my
yes.
heart, have conversations about end of life with the people around you, whether they are healthy or not healthy, whether they are dealing with a chronic illness or a terminal illness or no illness. When my mom and I had these conversations, she used to say to me, "But you don't need to worry because I am healthy and I am going to live forever. I plan on living until I'm 100." Well, unfortunately, that didn't happen. But in the process, I knew the information. I had that information and it was valuable. Boy, this was not the direction I thought we were going to go. I
No,
Not
thought we
we're
were
at
going off
talking
the
about,
all.
tracks.
hey, Mark, what about how to make your holiday not stressful? This
Yeah,
is
I saw that
stressful.
it is
This
stressful,
is
but
going to
it's
make your
needed to be.
holiday stressful.
But
Don't do this in
we've been
December.
I've had so many conversations with people in this group about that fact of talking to your people and making arrangements, and we've had death cafes about this and so forth and so on. But let's switch gears back to the holidays. So
Well,
we
no,
had some
this
good conversations.
Yeah, and this
Wait,
leads into it too, actually. Sorry, I don't want to interrupt you, but well, one, this can help us into the new year. This is maybe something that's on your goal list, like I'm going to tackle my 5 wishes. And even if you're the patient here tonight, maybe you're going to get those 5 wishes from your parents or somebody you love to keep everybody with that playing field, right? To know everyone's
wait.
wishes. Um, and then I was going to say too, actually, in our holiday pre-meeting, we were saying about how we don't love the scenario of you could be hit by a bus, right? But this goes into it could be your last, you might have that anxiety of what if this is my last holiday? Like I had written a note to my kids and put it in my Christmas decorations. So, I don't, it's in there. It just has lived in there for 5 years and keeps getting tattered. It's on an old napkin. But yeah, so I'm going to
That's
pass it
in,
back to you.
that is so, so important because we don't know. And I did say that. I said, I I often joke about that. I could be hit by a bus, but I will tell you that sadly, my sister-in-law's mom was out for a run and she was hit by a car and she was dead on the side of the road and they couldn't find her. And so when I say that, I only say that partly in jest because it actually did happen to someone in my family. That being said, anything can happen. My dad got COVID. My mom had suddenly got strokes and we didn't know what was happening with her. People's health can be fine 1 minute and deteriorate very suddenly. And it doesn't necessarily mean cancer, but it does mean that we have to be aware that every minute is precious. Every minute that we have to share with the people around us, very precious. So, yes, not hit by a car, not hit by a bus, but certainly anything can happen. Okay,
Yes.
Mark, what other questions have you got for me?
Well, in our pregame, we were talking a lot about this time of the year and how people frame this time of the year and Christmas, New Year's. We just got out of Thanksgiving, and we really need some coping strategies for some of these events.
So there's a lot of expectations that we have going into these holidays, don't we have really high expectations that everything is going to be perfect? Who was it who said, "What do we do about the perfect?" And I said, "We don't worry about the perfect. We worry about the present. We need to be present in the moment. And sometimes the present is imperfect. And sometimes that's what makes the holiday the most wonderful." Um, I believe that um, each moment that we get to share with people who we love, that's the important time. So instead of working on making that most perfect gift or that most perfect meal or those most perfect memories, because I don't think anything is perfect, what can we do to be present and in the moment?
So I think what I'm hearing is saying it's not just Christmas or the one day of the new year. It's every day that you're trying to stay in the present.
I believe that that's the most important. A long time ago, I think in the imperfect holidays. Thank you, Don. Yes, the imperfect holidays are definitely the most memorable. Um, One of the things that I think I had 2 years ago was this piece of paper, this image that had 5 houses in it. And
Mm.
the houses, I don't know if you remember that, but the houses were the painful past, the reminiscent past, the anxious or the worrisome future, the exciting future, and the present, the here and now. And the best place to live, the really the only place to live, is the here and now. Because if we're living in the past, even if it's reminiscent, even if the memories are good, we are still going to be dealing with sadness. And if we are in the anxious or worrisome future, if we are in the exciting future, we're still dealing with worry. So the present is really the only place where we're not having to live in that sadness or in that anxiety.
Yeah, especially with the unknown that we deal with. And can you tell us a little bit, since you deal with a lot of the care partners, PALKs as we call them, um, when the patient is getting therapy, sometimes it's really a family that needs to look at what we're dealing with. Is there anything from a PALK companion situation you can look at and advise on how, as a patient, we can try to have our partner go and get some mental health, go get some help professionally? What can we say or do?
Give me,
Is
give me,
there
give me a little bit more, Mark. What
You
are you
want to
looking
spit
for
out
from
my
me?
word salad? The word
Yeah.
salad is, how do we get our, if we know that our partner is struggling with what we're dealing with as a patient, is there anything we can do or say to try to help them see
I
somebody?
I think it's, well, one of the things that you can do is that you can bring your partner in with you to a therapist. You can go
Mm,
as a couple. You can certainly encourage them to go to support groups. The support groups that exist are wonderful. And sometimes you can encourage them, you can acknowledge that you can see that they're having a difficult time. And of course, they're going to have a difficult time. This is difficult. It's worrisome, it's stressful. You can suggest to them that they gain support, and they can do that the same way we had talked about before. Um,
yeah, that makes sense. Summer, Dana, do you guys want to jump in with the any comments that we have from the pregame?
No, this is all great, I think. So how do we tackle, we want to live in the present. How about for so many that are dealing with side effects and they want this perfect holiday or holidays, it's Hanukkah, it's whatever, and they're running around, or even if they don't, but they could on
do
a
we have any way to set? I would love for everybody to know that they're allowed to set boundaries, that they're allowed to set intentions, that they're allowed to say, I need to take a pause. Um, I think that I can do that for about an hour. And then I think I'd like to stop. Can we do it at this location so that it's not hard for me? Can we do it this way so that it's not hard for me? So I think that we can start to talk about what are our boundaries as the ALK patient or as the ALK caregiver. Um, do we have any like I have little signals between myself and my husband that it's time for me to go. It's time for me to go home. That I've had enough. And he says to me, um, I'll say to him, it looks like you're tired. And he'll say, I don't know if I'm tired. And I'll say, no, I think maybe you might be tired. And that means I'm tired. It's time for me to go home. So we have like these little signals for one another, and sometimes giving each other a pre-event signal. Like if I say this, it's time for me to go home. I've had or I might come and whisper in your ear, I've had enough, can we leave? Um, don't don't have you don't have to say goodbye to every single person in the room. I think that that's difficult. I think that you can say, um, I'm only going to stay for an hour. Thank you so much for having me, and then dip out. A party
we
doesn't
talk,
have to go forever.
we talk a lot about how to respond to people, especially this time of year. Of, hey, Mark, how you feeling? What's going on? It's
Oh,
just like that's
how
like
are
the
you?
typical. How are you? How you doing? Whatever.
Or
Down right
you
in my
look
mind.
so good.
You look, yeah, you look great. Like,
You're gonna
it's like
beat
I think,
this.
yeah, exactly.
Oh, that we were talking about the toxic positivity.
Hmm.
Oh, I had some really good responses, didn't I? And
You
now I
did.
can't remember a single one of
Oh my
them. What
gosh,
did
they
I
were
say?
so good. They were so good.
I was I was I was saying things like, um, I'm not going to be fine, but I look great now. Or what did I?
Yes,
I
no, they
was
were
I
so
had
good.
all sorts of snappy comebacks when we were talking. But you don't have to be toxically positive. You're allowed to say
Explain what that means.
toxically positive, so sickeningly sweet, positive that it puts you in a not good place, right? You're allowed to say thank you. I really appreciate your, I really appreciate your kind words. I'm really I'm not doing my very best right now, but I'm glad I look so good. Or it's amazing what chemotherapy will do to your weight loss. Uh, nothing like a good round of illness to cause me to look glowy.
Yeah. No, it's one of those things that I think we don't look like cancer patients. So I think
Mm,
that people think that we're not going through side effects from our medicines, even though we're not the typical
But but
patient,
we but we do know that that's what's happening. We know that you are going through, and your caregiver knows that you are going through side effects. And there are ways to, depending on what those side effects are, there are ways to politely say thank you so much. And also, that's not exactly how I must be managing I must be managing my side effects really well. Thank you so much.
and you don't want to be rude about it because a lot of these people you don't see
No,
year round. You
you
just
certainly
smile
don't
and
want to
kind of
be,
walk away.
yeah.
You know,
You don't want to be rude about it, and you can be kind about it. And also, you can know that that toxic positivity isn't, I mean, certainly you can say thank you so much and
and
not
move
go
on.
into anything.
Yeah.
Set boundaries, set intentions. Know that your wellness is what matters.
And you've seen
Also, we
this.
talk.
Oh God, Summer, did you want to
No, go
bounce
ahead.
into
Go ahead.
something? No, I don't, since you've seen the gyration, the years of me going through 5 different medications, 2 different clinical trials, we've talked a lot about the ups and downs of our disease. And you made a comment that you wanted Katie to mention that about our fundraising because you've seen the development of our medications,
Because
you know.
because I've often said to you, you don't have an expiration date written on your foot. Unless you are like a milk carton and you expire, you have the opportunity to continue to live, and you're living with an illness. You are not the illness, but you are living with an illness. And as you live with that illness, and you don't have that expiration date stamped on your foot or stamped on your, I don't know, where might we have that stamped on your bottom, where people can't see it. What if you live? And what if you get to the next trial? And what if you get to the next medication? And what if that next item happens to be something that is going to last for more than, Mark, sometimes you say to me, "Oh, this is scheduled to last for 8 months."
I'm laughing because that was the first medication. But no, her and I have been speaking many years about the duration of these medications and the length and what would happen if this and what would happen for that. And,
And
you know,
there's anxiety that emerges. And I think that I think we were just talking about the anxiety that exists every time we have to worry about a new medication or worry if there's a new medication or
mhm.
worry about that roller coaster. And Dana message just put in the messaging, don't forget to talk about tapping. And one of the things that we had talked about is that there are strategies that we can use to manage our anxiety. Some of the strategies include breathing. One of the strategies and some of the strategies are weighted blankets. Or Dana, can you pop on and show that really cool that that weighted sloth?
Yeah. The hands are weighted, so they kind of lay
And
right on the chest.
it makes it feel like a hug.
Yeah. So you can, I like sloths, so they have pandas and all sorts of, other animals, but I chose a sloth.
But those weighted blankets and the weighted sloth and things like that, that pulls your anxiety level down. Breathing. There's different breathing techniques. There's square breathing. There's 4-7-8 breathing. Um, there's 4-3-6 breathing, which is when I do it 4-7-8 or 4-3-6, where you breathe in for a count of 4, you hold for 3 or 7, and then you slowly exhale to the count of 6 or 8. That breath work enables your body to calm down. It slows your nervous system down. We were talking about anxiety and where it comes from, and I said that our anxiety generally originates in our kind of our primitive brain. Back in the back of our head, there's a little teeny piece of our brain called our amygdala, and our amygdala is highly activated and super anxious, and it causes us to engage in response like fight, flight, freeze, fawn, flap. It's how we respond when things become anxiety producing for us. And we were talking about bilateral tapping. And bilateral tapping is just very simply putting your right hand on your left side and your left hand on your right side and just tapping. And that process of tapping engages your brain in a way such that your your corpus callosum, which is the part of your brain that runs between the two hemispheres and runs from the bottom of your primitive brain to your prefrontal cortex, it creates a lot of activity and it causes your thoughts to move back and forth across your corpus callosum, and it slows down the fear and allows your prefrontal cortex the time and the space to take over. So the combination of the bilateral tapping combined with breath work will completely slow down any sort of anxiety. So that's just one technique as we become anxious that just takes a couple of seconds and enables us to slow ourselves down and be present in the moment.
Or Summer jumps in with a couple questions. Sissy, we've known each other for a long time, and you see other cancer patients with other types of cancer. Um,
Yeah.
what is so unique about ALK positive lung cancer?
Well, I think that one of the things that you said is part of the reason that I think it's so unique. Most ALK positive patients don't look like they are sick. A lot of my cancer patients have lost their hair and they are actively going through chemotherapy. And the treatment for ALK positive is different. And so you don't look sick. Oh my goodness, you don't look sick. Whereas other cancer patients appear to look much sicker. I think that um, I think that one of the things that is similar is that when you've been diagnosed with cancer, no matter the type of cancer, every ache in your body, every thing that you experience, you worry about whether or not it's a secondary cancer or it is it's the cancer spreading. It is all of those worries become far more prevalent. And I believe that no matter which cancer, we're still dealing with that anxiety. Um, Mark, I think that one of the things that ALK patients worry about a lot more is breath work. I think that breathing simply by the fact that you have to deal with your lungs and your lungs are absolutely being impacted um, by this particular type of cancer. Other people, other cancer patients, when I suggest breath work, they're very quick to go, oh, okay, no problem. And this particular cancer, I think we pay much more attention to how your lungs feel.
Plus, that roller coaster effect isn't as much for the other types of cancer,
Oh no, they're not getting scans every 90 days. They're getting scans every 6 months, or they're getting scans once a year.
right? I'll have Summer ready for you.
There's a whole bunch of stuff going on in the comments
Oh, yeah,
section.
check that
Oh, you want
out.
to jump in? All right.
Can I look at it for one sec?
Yes, please.
Got a question
Um,
from
5 wishes. I love that. Worry less about the present. Um,
oh, Tom makes a really interesting comment.
uh,
Hands
Now
that's
crossed near the
everyone will know
shoulders
what
is a
I'm doing
position
now. When I'm
used
at
to
the
prayer in
summit in
ancient
the corner.
times. You know, it's also
yeah.
a resemblance of a pretzel. Most of these are from down.
Um,
Can you look at Brandon's question?
yeah, Brandon, you have some different issues than the group. If you have a moment to take on an idiosyncrasy, I would, okay, of course. Let me have it. I'm ready.
Oh,
You,
okay. Can you folks hear me for a moment?
Yes.
yes, we
Okay.
can. Just to let you know that we are recording. So,
That's kind of you to remind me. I'm a caregiver. I'm not a patient. So,
Me too.
uh, at one level, I would like to make sure that the woman I love has as much comfort as she has. At another level, some of the techniques you do, um, and this may be, I think this is beyond ALK, so I'm not sure there's ever a good answer. Confronting the possibility of someone you love passing. I don't think deep breathing does that. I don't know what you do to try and address, while being a caregiver, the fact that the woman you love may be gone.
So, Brandon, what you're talking about is anticipatory grief. And that's something that I deeply, deeply understand. And that's something that as a caregiver, you're walking through the entire time that your loved one is managing their illness and you're managing their illness with them. And at the same time, you're anticipating what that life is going to be like. And I sometimes have called it 1,000 tiny losses. What we experience as caregivers is a thousand tiny losses. It's the loss of something small that somebody was able to do before. And you're right, breathing alone is not helping with that. And that's one of the reasons why I think Mark suggested things like really having a therapist who you can talk to, separate from your partner, because what you are doing is you're grieving. You're grieving, you're grieving all of the things that you had planned in the future that they may or may not be able to do with you. You're grieving all of the things that you used to be able to do on a Friday night that you can't necessarily do on a Friday night anymore. You're grieving. So when I'm talking about anticipatory grief and 1,000 tiny losses, you're going through all of those tiny losses before you even get to actually losing your spouse. And that's disheartening, that's painful, that's heartbreaking. And those are the things that I think when you say it's a little bit different for me because I'm a caregiver, you're 100% correct.
And
It is
you do
different.
work with, you've told me for many years that you do work with caregivers and people who have lost their loved ones. So this
I
is a
I
this is
it's not
a
an
long time,
unfamiliar topic.
right?
That's not an unfamiliar topic for me.
And
So
when
the
did you
answer,
start seeing people like that?
um, I I start seeing people like that when their loved one is going through. I have one client who I saw and they were anticipating their partner dying um, for many, many years because of the type of cancer that their partner had. They had a pretty severe form of cancer, and their partner actually had was like that small percentage of people who was wonderful and managed to go into a more chronically maintained way of being treated. And so that person who was anticipating their partner's death, actually their partner is still currently alive. So
Hmm.
it's a, we've had this talking about the roller coaster. This is a wife who had a roller coaster with her husband, and her husband is still.
If anyone else wants to ask a question, they can hit the reaction button, raise their hand. If you don't mind being recorded, you can ask your question versus typing into the chat because we only have about 15 minutes left. So, um, Summer, you had a couple comments.
Brandon, thank you for bringing that up and for sharing that, because that is it's a very different aspect to this.
And I don't mean to minimize the significance of what the patient is going through. I just think there's a different coloration to what the caregiver is going through. And I
A
appreciate your
hundred percent,
response.
Uh,
a hundred
absolutely.
percent.
And I'm so glad you asked it, Brandon, honestly, because this like gets me choked up, but I'm glad that it's me, the patient, every day. So as hard as it is, um, I'm glad that I'm going through it because I can't imagine having skin thick enough to be on the other side. So
One of the things that we were talking about, Summer, if you remember, is we were talking about the things we have control over versus the things we don't have control over and how that impacts us. And the things that we have control over, the things that we think we have control over, reduce our anxiety. And the things we know we have absolutely no control over elevate our anxiety significantly. So, whether we are a patient or a caregiver, the not knowing is so anxiety producing. What we have, just so that you can know what you actually have control over, you have control over your thoughts, your feelings, your actions, your reactions, your choices. You have very, very few bits of control over other people's thoughts, other people's actions, other people's reactions. You have no control over any of that.
and I just
One
want to
thing,
also, oh, sorry, Mark. I just want to
no,
also
go ahead.
again plug the healing arts because earlier on, Dr. Schurgin was saying how, or Mark or somebody, that um, these conversations might not be appropriate for people in your house. I'm going along. Um, most days, minimal side effects. I'm very sarcastic. For those of you who know my backstory with having a son with severe cerebral palsy, who nobody's off limits in our house. The past 20 years, that is how we move along. And my kids will say, we know, anyone with lungs can get lung cancer. But then I might join the fun and throw something in like, oh, how long will it take for you all to eat gluten after I'm gone because I have celiacs? Or don't make fun of your mother, save that for the funeral. And those aren't really appropriate comments to say to your family. Okay. So the healing arts groups are places where you can let these things on your chest, off your chest. Brandon, I can't recommend strongly enough the caregiver check-in. I think that that's a great place to talk with others. Art therapy, I always tease, was my gateway into giving back and becoming an advocate because I did just go there and I did exactly what Karen said, was created a legacy almost. And I would just, as much as,
Is
uh, just having an
because we
outlet
have
and talking to others.
because we have two art therapists, I'm just wondering, is it possible for one of the art therapists to offer a caregiver's art therapy group versus a patient art therapy group?
Yeah, that'd
I'm
be a
just,
I
great
would,
idea.
yeah, let's talk about that. Let's see if we can find a way to get that on the calendar. It would probably have to be in the evening because they may be working. So a lot
okay.
of the patients may have stopped working so they can go to art therapy. But I would expect that the care partners are probably still working. So let's talk and see if there's something
So,
that we can.
so perhaps a Pelkey art therapy group?
Yeah,
Yeah, that'd
that'd
be
be
great.
cool. So
Just
our second meeting, this brings me back to 2014, I think. You said to me, like, who do you think is part of your team? And I went through all my doctors, I went through my family, etc. And you said to me, oh, what's your faith? And I didn't exactly
what
know
about spirituality?
what's
How
about
does
spirituality.
What about
And I'm like, I
spirituality? How
don't know.
does spirituality
So
figure in?
it's kind of taboo to talk about this subject typically, but talk to us a little bit about because you do work for Spirit Counseling, which is based in a church. So tell us
And
a little
I'm
bit about
Jewish,
that. True, but
so I'm a Jewish girl who works in a church, and I am of the mindset that spirituality does not necessarily mean religion. Spirituality speaks to how are you connected to the universe in a greater way. And so when we start to think about our connection to the outdoors, or our looking at the stars, or our taking a moment to pause and go on a walk and look at the well, in the springtime, I love to say, go outside and look at the flowers. Go outside and take a moment um, take a moment on an evening and go look at the moon. How are you connected to the universe greater than yourself? Maybe for you, maybe your spirituality and your sense of connection has to do with music, or maybe your sense of spirituality has to do with practicing yoga or meditation or taking a moment of mindfulness where you try and clear your head of all of the thoughts, because the thoughts, quite honestly, our brain is super powerful and our brain thinks a million things. And I have frequently said, I'm not a very good meditator. And I had somebody who was a meditation specialist say to me, what do you mean you're not a good meditator? And I said, well, my brain is perpetually busy. I have busy brain. I am making lists when I'm not thinking about something else. And I am worrying about something and I am anticipating something and I've got a grocery list going and I've got a present list going and I am so busy. And they said, and when you have a thought. Let that thought pass like a cloud, and it will come back later. Let your thoughts pass like clouds. Acknowledge that they are there and let them move on. And that practice, that exercise allowed me a few minutes to say, oh, wait, I actually can meditate. Meditation isn't something that is about, again, it's not about perfect, it's about practice. And as we enter into the holidays, one of the things that's important to remember is that we're not just practicing imperfection, we're practicing all sorts of things. We're practicing small moments of joy. And when I say small moments of joy, a small moment of joy might be a cup of tea. It might be, although, Dana, we learned not chamomile for some people. Even though I even though I am a big proponent of chamomile tea as it settles anxiety, we've learned that chamomile tea might not be a good choice given certain medications. So I'm not a doctor, I'm a psychologist. So pay attention to your check everything with your pharmacist, right? Isn't that what we decided?
That's what we decided. But it was interesting. I think I said this in 2000, and I think it was 23. Dr. Suresh Gadgil, who was my doctor, was on a panel of doctors. And at the very end, he made a statement that he felt that spirituality had something to do with how people fare with their disease, which kind of shocked me that he said that. I remember people coming up to him towards the end. But it brings me back to that comment that he made to me in 2014. So that's
Because
real interesting.
because spirituality has to do with what gives you faith, what gives you
Mm,
purpose, what gives you meaning, what gives you a sense of there being something bigger, of you
mm.
having a reason for being in the world. And so that purpose, that meaning, that faith is all connected to spirituality.
Well, I really appreciate you coming on, and
Mark, did
I
you
didn't
want me to
guilt you into
do
coming here, did I?
Did you want
Yeah,
me to hit did you want me
yeah,
to hit
sure.
the self-care,
Yes,
the
please.
ways to remember self-care? So
Yes.
just so that before we leave, there's an easy way for you to remember the arenas in which to take care of yourself. My one of my clients put it in an acronym for me. We call it Pisces now, PISCES, and the P is for your physical well-being. Take care of your physical well-being. Eat healthily. Get enough sleep. Make sure that you are engaging in things physically that nurture and take care of yourself. See your doctor, see your dentist. Do those conscientious, those conscientious health related things. I is for your intellect. Your brain matters. And if you are doing things, reading, studying something, learning something new, whether it's cooking or an instrument, a foreign language, take a moment, take 5 minutes, and learn something new. S is for social, and your social support network is critical. Who are the people who you want to spend time with? Who are the people who bring you joy? Who are the people who elevate you in a way and make you feel loved and cared about? Those are the people to spend your time with. PISC, creative. Join the art therapy group. Engage in some sort of creative endeavor, whether it is cooking or or a craft or music, playing music. Sometimes something so little that you can create, baking a loaf of bread, that can be an act of creativity. E is your emotional well-being. Create a journal. Journal your thoughts, journal your feelings. Talk to people who are important to you. Those people who you can share your thoughts and feelings with. Um, emotion, what PISCES, spiritual, that spiritual component that we were talking about. And then I said one of the other two letters that have been added on by a couple of my clients have been E and F. E is your environment. Your environment matters. Having that something cozy, having some smells that warm your heart, having things look the way that give you some sense of joy, whether it's, I had somebody say to me, they put up their Christmas tree and they just had the Christmas tree with the lights up. And they said, I'm not putting up all of the ornaments. I'm not doing all of the decorations. It's a pre-lit tree and I put a skirt under it and that's all I'm doing. And I said, sounds terrific. And I said, why? Just tell me why. And she said, because the environment, the lights make me happy, but I don't want to have to do all of the work that has to do with putting up and taking down the ornaments. Good for her. That was a wonderful boundary. And then F is finances, and your finances matter. Make sure that you're not overspending. Make sure that you're taking care of the things that matter in your life. How about that?
Right.
I love
That
that.
sounds good.
That was so helpful. I'll need to get a little printout of that though, so we can share it with
Oh,
everyone.
if you
I
happen
wrote
to
it all
go
down,
and
Summer.
like,
Oh, she went through it. I wrote it down.
if you
Thank you.
go on Samaritan, I think Samaritan Counseling Centers of Southeastern Michigan, our Instagram, someplace on there there's all of these little helpful, wonderful tips. We put up a thing called Mindful Mondays and Wellness Wednesdays
I
and Feature
Amazing.
Fridays. So Samaritan Counseling Center's Instagram site has all
Is
these
it
sorts of
okay?
helpful hits.
Can I link that in our YouTube description so people could just watch it and
100%.
Oh, Tuesday
awesome.
tacos.
What?
Oh, Tuesday tacos.
Tuesday tacos. Yep.
Okay, so before we let you go, Summer, what is next week?
Next week, we have a breakthrough cancer update to close out the year. The past 2 years they've been annually, but we're giving you an update on what has been happening behind the scenes there. So it is very exciting. Jesse Bohm will be with us. So we are looking forward to that. And then in the new year, kicking off ALK Talk on January 11th, I believe, Dr. Alice Shaw will be back with us. So that will be exciting to start the new year with an update on her latest research and what's happening in the world of ALK. So thank you so much, Dr. Schurgin. I'm so glad you said yes to Mark's request.
Of course.
We were so happy to have you back here. And this is definitely a talk that I'll encourage people to definitely listen to a few times because there's so many different little nuggets and pearls of wisdom that I think all hear at different times. That you might not take everything away today, but you might need to revisit it again at another time. So thank you
I
so much.
appreciate Brandon coming on and sharing his with his feelings, and I think that's so important. So we should try to address that too.
I came on late.
So,
Absolutely.
all right, thank you so much. We
Thank you,
appreciate it.
everyone, for being here. Oh, yep.
You guys can mute and
Yep.
say
There you
thank
go,
you.
Tom. Thank you.
Yes, everyone, if you'd like to unmute and give a shout out of thanks, and we will see you next week.
Thank you.
Thank you
Thank
very
you.
much.
Have a
We do-
wonderful
we
evening,
want them to-
everyone.
How can we
you.
get
Thank
the
you.
recording?
Oh,
Mark, how can they
I'll
get
send
the
it right
recording?
to you, Danny.
Okay.
Don't
Hey,
worry.
Summer. All
But
right,
it will
thank you.
be. Hi, John. Hi, Danny. Yes, we'll send it. I'll send it right to you. But give me a week, and we'll get that up, and then
Okay.
also be in the different groups.
Oh, a week?
Yeah, get with us.
Yeah,
Come on,
a
Summer.
hot minute.
All right. Thank you, Summer.
You're so
Take
welcome.
care, everyone.
Thank you.
Have a great
Bye.
night.
See ya.
Thank you all.
Bye.
Yeah.